Hi, everyone. This is Yael Schacher, and this is the sort of the breakout room. I'm just going to wait like one more second because I'm not sure everybody's here. So just a minute. Okay, I'll just start with some introductions to give people a little bit more time. Thanks so much for coming and for your interest in this. I think will come forward most important is how essential it is for doctors and public health experts to weigh in on the questions that I'll be talking about. The reason I say that is because a lot of border policy and detention policy is being made in a way that I think is pretty uninformed by public health safeguards and how to best manage in a pandemic, and instead is being a lot of the policies are very driven by politics and ideological priorities around migration that really don't have much to do with public health at all. Public health is being manipulated politically. So it's really it would be a fantastic time for physicians to really weigh in, mostly because some of the people like me who are sort of experts in immigration and asylum and international law, like the law of migration, I can make arguments about why certain policies violate our international law commitments to allowing people to seek protection at the border. And they clearly are, because some of the border policies I'll be discussing really do violate our laws, our own laws, and our commitments that are in our laws. But the argument that's being made is that public health sort of overrides any of those commitments. And as I'll discuss, the Trump administration has been wanting to, and sort of has needed a reason to close the border since it came to office, and it's now using this pandemic as the reason. And some of its arguments seem very, very driven by that goal and not by any real public health desire to protect either the American public or to really think about how to deal effectively with migrants coming in at the border. As I said at the outset, I work for Refugees International. I'm trained as a historian, actually, and started working at Refugees International about 2 years ago. I spent most of 2019 traveling along the U.S. southern border, looking at some of these policies that were put in place before the pandemic to sort of impede access to asylum at the border, and what that did, mostly sending people to Mexico without much provision for their basic needs, including healthcare, and also sending them sort of dangerous locations rather than allowing them to access asylum at the border and to be admitted. Since COVID-19 started, I haven't been doing much traveling, but I've been focusing on trying to gather as much information for people I met at the border about what's going on there. But I certainly can tell you a little bit about the policies that have been put in place since COVID-19 started. That's what I'll start at the border, and then I'll move on to detention. So what happened at the border since COVID-19 became a national emergency? So on March 20th, the U.S. Department of Health issued a rule directing the Center for Disease Control to close the border to anybody who did not have documents approaching the border, including asylum seekers, on the grounds that they would be sort of vectors for transmission of COVID-19, and also that admitting them for processing would require that they kind of stay in congregate Border Patrol settings that would actually let COVID-19 spread there. So while the administration claims that it's crucial to this rule closing the border, which is still in place, is crucial to kind of containing the pandemic, Many former officials have already come forward and said that the White House basically pressured the CDC into authorizing this policy, overruling many public health experts there who believe that there is really no sound public health justification for this policy. Why? Why did they say that? Because the CDC order is this broad sweeping ban, not saying that like we won't admit people who have tested positive, for example, but just saying we won't admit anybody who shows up without papers and wants to ask for asylum. Meanwhile, truck drivers, Americans living in Mexico, commuters, business travelers are flying into airports and crossing the border all the time. So it seems like it's targeting a very particular population for not coming in, and then saying that it's because of public health when all these other people can come in and spread disease, so it doesn't seem like it's containing the disease effectively, if that was actually the goal. Also, there's not really a good reason to actually, for that second prong in the argument for the order, that if you let people in, you have to process them, and you'll have to keep them in congregate settings while you're doing it. That's not actually true. The Border Patrol could sort of screen them quickly and release them to family members or sponsors, which almost everybody has sort of waiting here on the US side. So the argument that, it couldn't be done safely is also sort of a bit misplaced. As soon as this order came out, by the way, I worked with Chris Byrer, who is an epidemiologist at Johns Hopkins, to write a little policy brief on precisely what I just told you, that, well, I made the argument about why the border order violated our international and US law legal obligations to allow people to seek protection at the border, which have been in place since the 1980s. And Chris helped me make the arguments about why some of these public health justifications were flawed. Since the order went into effect, hundreds of thousands of people at the border have been summarily expelled. And that includes thousands of asylum seekers and 14,000 unaccompanied children, which is just a lot of people. Expulsions can be done in two ways. So the order could be put in place in two ways. People can either be deported to their home country, like right away, or Central Americans. The United States government made a sort of deal with the Mexicans that Central American families and adults could be sent to Mexico to wait there, again, sort of along the lines of other policies they had put in place before the pandemic. Now, crucially, testing is not mandated before deportation. So this has meant that many of the people who've been expelled have actually been sick, or at least they had tested positive. In other words, actually, most people before being put on deportation flights get their temperature tested. But as you know, you can not be symptomatic and be positive for COVID-19. And what we do know is that some of the people who have been deported through this policy have showed up in Guatemala, for example, and tested positive when they've gotten there. So in fact, we're actually exporting the disease through this policy to countries that have much weaker health systems than we do to deal with it. So this is not, again, it's not only not effective for dealing with public health here in the United States, but given, how rapidly given, the number of people we've been expelling and deporting, we're also definitely spreading disease. And I should say, we're also deporting people, and I'll get to this later, from ICE detention, not just people who cross the border, but people who are detained and have been detained for a long time, or who are arrested, from within the country. And those people can clearly catch COVID in detention, and then we're exporting it. So in many ways, deporting people is not an effective public health policy, especially if you think of this as like a global problem, right? Okay, so like the border policy is ineffectively protecting the United States, but since the United States is now one of the centers of COVID, where we have more cases than most countries, any deportation policy is also going to export the disease elsewhere. It's not going to help us combat the disease globally, that's for sure. Just this past week, a court ordered that the unaccompanied children actually can't be expelled. A lot of the most successful opposition to some of the Trump administration's immigration policies have actually come from the federal courts. And there's a ruling just this past week that, unaccompanied children at least have to be admitted, and they have to be turned over to the Office of Refugee Resettlement, which shelters those children until sponsors can be found for them. Meanwhile, what's happening to the people who are continuing to be expelled on the Mexican side of the border? So what we know is that people are pretty much stranded there, and not much in the way of food and shelter. And if some of them, especially in the city of Matamoros, which is right across from Brownsville, Texas, there's sort of like a tent encampment there, which is a terrible place. It's like any kind of refugee camp where COVID could spread easily there. So this is not, an ideal situation. And for those coming northward, there have been some efforts by the International Organization for Migration to set up sort of like a filter hotel in Mexico. So these are not the people being expelled, but new migrants coming north. A filter hotel, which will basically quarantine people until they can be sent to the shelters. And actually, that's proven effective because it's kept most of the shelters in Mexico pretty much COVID-19 free by having that like quarantine before people are sent to shelters. What we really need from physicians, as I've said, if we want to like kind of move past this border closure. So President-elect Joe Biden has basically pledged to direct the CDC and Homeland Security officials to review this expulsion order so that migrants are allowed to make asylum claims. But he also said that any changes to this CDC order will be guided by public health experts. And what we really need from you guys right now is that guidance for how to actually effectively screen people in, and what kind of public health safeguards should be put in place at the border so that we can actually allow a lifting. Because the Biden administration really, there's going to be a lot of political pressure for him on the other side to kind of keep the border closed. But I think what this is a great opportunity for public health experts to really put their heads together and think about how can we advise politicians about effective ways to open the border and to sort of screen people in a socially distanced way using PPE, maybe testing people before they come in, then figuring out how to transport them safely, whether or not they need quarantine. I mean, all of this requires knowledge that me as an immigration law expert, I'm a little out of my element here. And I think it's really, if you have good ideas about how to do this, it would be great to write it up, to put out policy papers, to help advise, the incoming administration about really to show that this is feasible, to show that from a public health perspective, we can do this. Yes, it violates human rights to keep the border closed, but can we feasibly let people in accord with human rights, but also protect the public health, do this in a way that doesn't like, make those two things opposed to each other. And I mentioned that the court has now said that children have to be released to these Office of Refugee Resettlement shelters. I mean, how do we make those safe for kids? We don't want to have big influx facilities where lots of kids are in basically big tents in the desert somewhere like we used to have. So how do we make it safe? ORR, which is part of the Office of Children and Families, needs help to figure out how to actually do this in a way that would work. And I'll end with just a couple of comments about ICE detention centers, and then I'm glad to take any questions that you have. So you may have already heard, because it's gotten tons of news press about the situation at Irwin, a detention center in Georgia, where there's been a nurse whistleblower basically came forward and basically talked mostly about the lack of COVID-19 protocols in the detention center. Basically, not even like basic sanitation being used there. They actually had test machines to do COVID testing, which they weren't using. I mean, just basic fundamental medical neglect going on at that center. And other issues of medical neglect related to forced procedures for women, which I'm not going to get into today. Suffice it to say that medical neglect in ICE detention centers, especially those run by private prison corporations, is rampant and has been going on for years. The question for us, and that has been a problem for many, many years, and we've all known about this, and there's very little oversight, and it's terrible. But COVID-19 has made it so much worse because there was already a lack of care, and now this is now overlaid on top of it. So now there are currently about as of early November, about 7,200 individuals who were in ICE custody who tested positive for COVID-19. And that's definitely an undercount because, as I said, there's some places that are just not testing people, even, so we don't really know, but ICE officially reports that they have over 7,000 cases of people who have tested positive in detention. And a research letter published by the Journal of the American Medical Association actually studied the rates of COVID-19 infection for individuals detained by ICE and determined that individuals detained by ICE were 13 times more likely to have COVID-19 than members of the US general population, between April and August. So we're talking about hot boxes. When people say, where things spread, that's what they mean. That's a huge, huge discrepancy inside, outside detention. The situation in some detention centers is absolutely notorious, so much so that federal judges, again, the federal courts have stepped in and rebuked ICE for deliberately taking absolutely no precautions against spread, mostly because of a desire to avoid cost issues and to fill detention beds, which has been basically the bottom line of a lot of these private prisons for a long time. There's a lack of even basic sanitation, social distancing, lack of testing, PPE. Several deaths of detainees in detention have been reported, but again, these are undercounts because people who have tested positive have been deported. So we don't know what happened to them later. And because ICE tends to, when people get really sick, ICE tends to release them and then they die at a hospital, somewhere. So that's not counted towards the ICE statistics of how many people died in detention, if you think about it. ICE generally has not released people, even though they have absolute authority to do. And I want to just emphasize, people in immigration detention are not being detained for having committed a crime. Okay, immigration detention is civil. What do I mean by that? If you are an immigrant and you committed a crime, first you will serve your time in regular prison. Then after you finish your sentence there, you will be transferred to an ICE detention center where you'll wait deportation. That second detention is not for, you've already, done your time for the crime, okay? This is separate. And a lot of people who are detained in ICE facilities haven't committed any crime ever. They just crossed the border illegally without documents, right? So they haven't actually committed any crime. They're just waiting to be deported, basically. That's what it is, right? And so it's supposed to be a civil detention, which is an oxymoron to me, to have civil detention. But anyway, that's what it is. And ICE can officially release people. I mean, it's at its discretion to release people, or detainees can ask immigration judge for bonds to be released on parole. So it's discretionary whether or not people remain detained. What the court was able to do was basically say that people with underlying medical conditions that would make them vulnerable to COVID-19 ICE must review their cases and consider them for parole. You cannot, especially for these particularly vulnerable populations. The court has already ordered testing of them. You can't use punitive housing, you can't basically punish people, which is what they're doing. You have to have special protocols for these vulnerable cases, for people with underlying conditions, and you just can't just do blanket cursory denials. You have to review the cases and release people if they're eligible for it. I just have to say that, this has not really been done regularly. So people with vulnerable conditions are still being detained, but at least the courts are trying to get some of those folks out. Again, ICE generally doesn't release people. So for example, they gave detained families a choice, because there's family detention centers for people who are, women and children together. And they basically told the moms, okay, we'll let you release your child if you want to, if you're worried about them catching COVID in detention, but you have to stay detained here. So that was not really a good choice. That's not really a choice. They're like a Sophie's choice. So that didn't really work out. They really don't want to release people if they can avoid it. And in fact, Reuters has reported that people are actually spending more time in detention under COVID than they have before. Again, not making much sense. The other thing that is important to note is that there have been particular detention centers where the conditions are so bad that federal courts have basically ordered the government to reduce the population size. Adelanto in California is one of those places where they said, you've got to just, it's too crowded in here. You've got to get the population down. You have to start releasing some people. But just yesterday, after that order to Adelanto, I heard from an attorney out there basically saying that an immigration judge at the Adelanto Detention Center ordered a detained, mentally incompetent, sick individual with COVID deported in absentia, okay, meaning that he's going to be deported because his symptoms, his COVID symptoms, prevented him from leaving his prison cell and entering the courtroom in the detention center that exists. Whenever I can, ICE, DHS will rush a deportation rather than a release somebody. That has been the basic policy. And this includes asylum seekers who will actually possibly be in danger when they get back to this home country. There was a bunch of Cameroonians where this happened to. And, you know, there's currently tomorrow 28 children and their families from Central America and Haiti who have actually been detained for a long time in one of these family detention centers are slated for deportation rather than release. So, you know, this is a huge problem right now, right across the river in New Jersey. I don't know where all you guys are, but I'm supposedly through New York, right? But in New Jersey, in Bergen County Jail, there are a bunch of detainees who are striking for their release. They're on hunger strike. These people had been in the Essex County Correctional Facility, and for some unknown reason, they were transferred to the Bergen County Jail, where conditions are terrible and they're confined all the time. It's usually solitary confinement because there's no other way to safely manage the population. So besides deportation, ICE also used this cohorting strategy where anybody who has tested positive is then put with other people who test positive. And then it also uses transferring, where it transfers people from one detention center to another rather than release them, which obviously spreads disease from one detention center to another detention center, which has actually happened. Many African asylum seekers on the West Coast have been transferred from California to Louisiana. And there's also been this pattern that advocates have noticed that ICE tends to transfer particularly those people who engage in protest about their confinement, like hunger strikes. So like those people are causing trouble, making it difficult, and getting bad media attention to particular ICE facilities. So they get transferred somewhere else rather than release them, which is what the hunger strike is all about, obviously, to get released from detention and to basically be allowed to shelter in place and, you know, stay somewhere, you know, with an ankle monitor if necessary. I mean, there's a way that you can release people and still monitor them and still require that they, you know, show up after all of this. But most of these people have active cases in the courts. In other words, these are people pursuing immigration cases through the immigration courts. So they have to show up for their hearing. They haven't yet been, it's not like their cases are done. If their cases were done, they could be deported. A lot of these people, the reason they're in detention so long, so they're still pursuing their cases through the courts. And what we need is to be able to release them during that time period, especially now, because keeping them in detention is extremely dangerous. And they're likely to catch COVID-19. But advocates have been pushing for a long time. I mean, we have in this country the biggest immigrant detention system in the world. We have bed capacity for 55,000 immigrant prisoners, you know, in our detention system. No other country has anything remotely that large. Again, for civil detention, just awaiting deportation, like I explained to you before. Because of COVID and other reasons, we're down to 17,000 people in detention right now, in ICE detention. And what advocates like me really have been pushing for is to make it like, you know, we don't want to go back to 55,000. Like, we're down to 17,000 people in detention. We certainly don't want to like build up the system. What we need to do moving forward is make sure that Congress allocates money for alternative to detention programs, case management, ankle bracelets, whatever you want, rather than, you know, keeping people in these unsafe detention centers that are really inhumane, and also they have not been proven to be more effective than case management or alternatives to detention in terms of making people show up for their court cases, right? So the big argument about why we have to keep people detained, period, is that, oh, they'll never show up for court, they're going to disappear. There is no data to back that up. None. When people are put into family case management programs where people have ankle bracelets, they show up to court, they have bonds, paroled on bonds, they show up to court. They don't want to lose that money. They don't. Most of the people pursuing cases in immigration court want to stay in the United States. Why would they disappear? They want to fight their cases legally and through the courts. So anyway, there's no data to really back up this ostensible reason for a ginormous detention complex for immigrants. And so, there are a lot of proposed legislation that would really help this. There's something called the Dignity for Detained Immigrants Act, which basically would curb the use of detention and make it so that, detention is not the default, but the exception. So only, not everybody's put in detention, that the government would have to prove why people need to stay in detention rather than the immigrant have to prove why they should get out. So sort of shift the burden of proof on this issue. There's another bill that Senator Markey from Massachusetts has proposed to sort of stop immigration enforcement during the pandemic. So have a moratorium on immigration enforcement activities, which would halt deportations, stop rounding up people to be put into detention centers, and also resume, sort of open the border and not allow for basically the expulsions to happen. It would be a sort of halt on basically immigration enforcement moratorium. And then, there's just appropriations for Congress. What really needs to happen is we need to appropriate money less for detention and more for these alternatives, which would be much more humane and also much better for health. And I can put some, resources in the chat at the end that, talks about all of these, but that's pretty much, what I prepared to say. And I'd love to take any questions that you have. Now I'm looking at the chat to see. Okay, I see a question from Tom Griffiths about criminal networks exploiting COVID for drug and human trafficking purposes. Okay, so I've written about trafficking at the border before COVID. What I would say is that the border restriction, like locking the border the way it is, we know from the numbers that a lot of the people are summarily expelled and then just come right back in. Recidivism in terms of illegal entries is up, way up, because if you just sort of expel somebody, they're just going to come right back. And if you keep the ports of entry closed, which is going on to the people without documents, ports of entries are closed, obviously you're going to get more people entering between ports if they want to come in. I think the smugglers have, made use of that. So if more people are reliant on entering between ports of entry illicitly, the smugglers are going to make hay of it. So that in terms of migrants, trafficking, I think, Border Patrol is, I think on the Texas side of the border, what we're finding is like a lot more stash houses. And I think the fact of the matter is that people are worried that they're just going to be summarily expelled by the Border Patrol. So they're definitely relying more on traffickers to get them in. And then there's probably an increase in people being held at stash houses underground for long periods of time. And what I've written about in the past is what those stash houses typically become on the Texas side are places of rape against women and forced labor for everybody who are held there. So then it actually does become a kind of trafficking situation. What started as sort of like a smuggling situation to avert restrictions on entry quickly become sort of trafficking situations. I think probably the best way to deal with that is to open the ports of entry and allow people to apply legally to enter. That would help. It would diminish the incentive to go with a smuggler. If you actually had a legal pathway, that would help. The other thing that would help is for people who have been victims of trafficking to actually be able to apply for visas as victims of trafficking, which we actually have, to focus more on providing support for the victims that we find. So when CBP finds a stash house, what does it do with all the people that have been confined there for weeks, possibly raped and forced to work? Just deports them, which, without inquiring as to, and yes, it might prosecute the smuggler, but the vast majority, most attention is focused on basically deporting the migrants who are found in these stash houses. So I think there's probably a better and more humane way of dealing with it, that trafficking situation. So that would be my answer to that question. Yes, there are a lot of on the public perception question, which is a fantastic question. Thank you. I think there's a couple of misconceptions about asylum seekers that need to be debunked. One is that they come to the border and just overwhelm border communities. If you let them in, they'll just overwhelm border communities. The vast majority of asylum seekers at the border have family or friends whom they're trying to unite with elsewhere in the country. What that means is they usually spend a day or 2 or 3 in border communities, and then they move on. So the capacity issue is not really, it's a fake issue, okay? Because it's not, and this overwhelmed border communities thing, it's a fake issue. It's just like sort of created to scare people that there's a crisis. So just put that aside. The other thing, and the fact that they do have family members, I mean, they're not criminals. Most of the people who are, as we know from the statistics, the vast majority of asylum seekers at the border since 2018 have been families with children. So there's been a shift in the population from adults, single adults, to mostly families with children. So again, about what these populations are, you know, President Trump went on TV and said these are cons, these are fraud, they're full of tattoos, they're gang members coming in. Like, that's not the population that we're dealing with right now. We haven't been dealing with that population for a long time. So that's another way, I think, you know, making it clear who these people are. First of all, that they typically have family members in the United States. And the reason they have family members in the United States, because most of these people are coming from El Salvador, Guatemala, and Honduras, which in the United States, we've had those populations in this country for a long time, many of them in undocumented status. So they can't sponsor their relatives to come legally, right? Like, that's just not. So our undocumented problem in this country, the fact that we have large undocumented populations who have been living in the United States for on average more than a decade, okay? Now have kids and relatives, and they left their children with grandparents who now want to come here, and the violence is getting much, much worse in Central America, and has been for the past couple of years. So I'm not saying they're not fleeing harm. They have, because the situation has gotten much, much worse there. And we really need to spend a lot more time talking about why and the root causes driving people to flee, which is not just, you know, the economic havoc created by this pandemic, and the devastation there, and the lack of jobs and food, but also rampant violence and gangs. And so gender-based violence is a big issue. And so people are coming, and they're also, but they also have family members here. That's all I mean to say. It's a combination. But that's a great question, because I think what we're going to hear, and we're already starting to hear, is the hysteria about surge. There's a surge of asylum seekers coming to the border. I just want to banish the word surge from the language. And what that will do, that media hysteria will do, we're going to have all these border communities that are completely overwhelmed. We can't handle this. We can't. And what that's going to do is immediately foreclose real political investment by the Biden administration in changing policy, because they'll be too scared. And I'm not going to waste my political capital like combating this media hysteria. So what we need to do is, I feel it's my obligation and yours to combat that media hysteria, to give the Biden administration the political space to make a difference here, because otherwise they'll just say, like, this is too touchy, we're not going to touch it, we're not going to go there. We've got plenty of other immigration policies that we can overturn. We can overturn the Muslim ban, and we can overturn all the other horrible policies that the Trump administration has already put in place. But, you know, the border, that's tricky. Like, let's just leave that closed, you know, or, you know, so I think it's really important that everybody sort of push back on that. Okay, as telehealth has become more popular, are there currently bills plans for allowing immigrant detainees to have not that I know of. That's a great idea, Mike James. That's fantastic. You know, that's exactly the kind of thing that would be great. I don't know of any of it. There may be some detention centers that I don't know about, I don't know everything, that have sort of put in place those kinds of telehealth possibilities. I know they have been trying to put in place situations where you can go to, like, unlike that case that I mentioned to you, where that man was deported in absentia for not being able to attend a court hearing. I know they're putting in place virtual court hearings for people to sort of make it safer, so that people can kind of attend court without actually attending court, which would be unsafe anyway, even if you weren't in detention, because any public courthouse space is like not a great place to be for people to sort of be going regularly, people who are not detained even. So that would be a great idea, but I don't know about it. It would be precisely telehealth would be precisely the kind of thing that needs to be in the policy toolkit of people moving forward to make sure that, we move in the right direction on this. I'm interested in doing border control, public health policy research. Yes, so that that is so great to hear, Hein, if I'm pronouncing your name right, about the person who wants to do border control, public health policy research. There are a few places. I'm going to put my email in the chat right now. Just make sure I spell it right. And you can feel free to contact me. I know there are, so Human Rights First, another organization, has been working with the Columbia Mailman School on putting in place, and also I think PHR actually, on putting in place, coming up with guidelines for how to, like I said earlier, sort of process people in safely at the border, public health guidelines. So I know folks at the Mailman School would probably be good to refer you to, and also a couple of people at Johns Hopkins, not that many. And I think there are a couple of people in some of the California-based universities closer to the border that are doing more work on this. So if you contact me at my email address, I'd be sure I'll look up which of those programs I know about. I know about them. I just don't have them on the tip of my tongue, and I'd be happy to put you in touch with those folks. Okay. Yeah, great question on what other countries we should look towards. And I just actually just this past week on better ways of handling this situation. In Europe, many European countries have lifted the border restrictions and have actually been making it people able to do asylum interviews rather than have to come in person, and avoid this concern about processing centers and congregate settings where people have to be processed. I think Sweden has that. I have to check again. There are a couple of other countries. Germany has better ways of lifting border restrictions and conducting screenings, immigration screenings and fear screenings for asylum claimants to allow them to sort of not keep the border completely closed to asylum seekers. On detention, this is something Refugees International just had an event on detention and alternatives to detention, and I'll try to get the link and put it in the chat. You can, if you go to better yet, because if you go to the Refugees International website, which I'm putting Refugees International, that's just the on the website, you'll see if you click on my name, Yael Schacher, it should be already posted under my work. I run a series of events called Voices from the Border, and the one we held just this past week was on detention and alternatives to detention, and we had as speakers at that event folks from Canada who have a different attitude towards detention than we do here in the States. I think right now they might have 200 people in detention, really, really limited numbers of people in detention. They have a different border screening policy. When people come and ask for asylum at the border, they're screened quickly and released. They don't go through detention at all. And detention, again, one of the things that they do is detention. Anytime somebody's put in detention, they'll have a detention hearing every couple of days to see if that if that detention is still necessary, can they be released? And we don't have anything like that. Once you're in detention, it's like you're in detention. They throw away the key. There's no like regular screenings about whether or not you can be released. And the International Detention Coalition basically has several. I'm going to put a report in the chat from the International Detention Coalition about alternatives that are available and what other countries do on detention issues. Because I would say the United States is the outlier rather than the norm. Almost to answer the question in the chat, almost every country in the world does it better than we do on detention or has a different policy. And I'm also going to put in the chat, I think I just sent that to somebody. Oh, no, I didn't. The International Detention Coalition also has a new report on detention during time of COVID, and how even during a time of public health pandemic, there are other ways. So let me put that in the chat as well. I think we're out of time. I'm getting messages but that ID Coalition COVID-19 Alternatives to Detention has a whole list of what other countries have done, unlike the United States, to sort of better deal with the problem of detention during a time of pandemic. Yeah, so I think I did almost all the questions. But if you, I'll put a couple of more resources in the chat really quickly, just on if you want, more information about policies related to COVID in the United States. I have to actually, the links didn't come through, but I'll put the links in separately. Let me see. That's the Freedom for Immigrants, the Defense Network. These are just give you some data on and databases about what's going on in terms of COVID related advocacy for migrants in the United States. Maps of where cases are in detention, what litigation is going on, and other related things. And please, if there's any other resources that you think that I can provide, please feel free to email me. Be glad to, or any other questions you have that I didn't address today. I'd be really glad to answer them by email. So thanks so much for having me.